Hello, and welcome to Health Talks, a doctor-led vodcast by HDFC ERGO General Insurance, one of the leading general insurance companies in India. I am Neeraj Nayak, Joint President and Chief Underwriting Officer at HDFC ERGO, and I will be your host for today. We believe being aware and being prepared are very important. Good health begins with awareness, and as they say, prevention is always better than cure. Globally, rough estimates say that there are 2 billion people who suffer from some kind of health-related issues. In India, the number could be even higher. They also say that almost 80% of issues related to eye can be cured if detected in time. Hence, we say good health begins with awareness. Today, I'll be talking about a very important issue, which is eye health, health of our vision. And with me, I have an expert in this field, Dr. Amjad Furniturewala. Welcome, Doctor.
Thank you.
Doctor, in today's digital lifestyle, what are the most common eye problems that you come across?
See, just as we were discussing of this, our bodies, we were not made, not programmed to sit in front of the screen for 8 hours, 6 hours, 10 hours a day.
Right.
To believe that we are not going to have a problem with this rapid digitalization, it's untrue. And how much of it? It's significant. Significant enough to cause you headaches, eye strain, eye dryness, discomfort, and so on. So, why do we get this? Obviously, there are a lot of factors into it, but again, there will be some strain on the eyes with people who are on this platform for more than 6 hours a day.
It's unavoidable.
It's unavoidable.
Okay. A slightly serious question. How serious is the rise of myopia amongst children in India?
Significant. Something which was like, again, I would say we'll divide into pre-COVID, post-COVID era. And we've seen a rapid surge in cases of myopia post-COVID.
Okay.
So I wouldn't say COVID has been the cause, but
Right.
the shift, the huge shift to the digital platform post-COVID. And suddenly if you see the number of cases of myopia today, in the last 5 years, it's almost double, tripled in so many areas.
Oh, that's a
That's
serious
a very,
problem.
very significant numbers we are talking about.
And you mentioned COVID is not the reason, but it is the shift in usage of various gadgets. The screen time, mobiles, laptops, they have become inseparable today. What are the precautions or what are the checks that one should have to ensure that it doesn't impact their vision?
See, two parts, like checks and prevention. So, with digital lifestyle, the 20-20-20 rule. Like everybody or most of us have heard about it, but implementation is poor because understanding why you're using it is again a challenge for most people. So what's this 20-20 rule? It's basically every 20 minutes, you look at an object which is 20 feet away. Now what does this mean? Is first, after 20 minutes, you give the eyes a break. You look 20 feet away means you're trying to focus at something which is 20, considered at infinity. So all the muscles are not focusing, they just relaxed. And when the muscles are relaxed, the eyes relax, your blinking rate increases. So thereby it lubricates, moisturizes your corneal cells and takes care of the health of the eye. So 20-20 rule is an eminent preventive measure. And checks, so I think your annual eye checks are of paramount importance.
So 20-20-20, this is something that everyone should adopt. It's like giving your eyes a break, a rest, like your mind, your eyes also need some rest. Beyond eye strain, how much do conditions like cataract and glaucoma affect normal average Indians?
See, we're seeing a rise of cataract in the third and fourth decade of life. Now, multifactorial. It's like it's too many etiological factors to go into the depth of it. But cataract is fine. It's like a blessing in disguise. Surgery will remain the only modality of treatment, but you end up getting a fabulous vision. And given a choice, you may be spectacle free for the rest of your life at whatever point. So, cataract is not a feared disease or a complication. Vis-a-vis glaucoma, I would be more worried about glaucoma because it's called as a silent thief of vision. Reason is anybody who suffered from glaucoma has never suffered a symptom. In fact, whenever a patient of glaucoma is diagnosed with glaucoma, first thing is that, is this guy telling me the truth? I have nothing. And every ophthalmologist has patients who come for the second or third opinion because somebody told them glaucoma and they felt unsure.
Right.
So, this is the challenge of glaucoma, that it's asymptomatic, but it is causing irreversible blindness. Cataract, patient may go 100% blind, totally gone, but it's operated and the patient will have without glasses a 6x6 vision. Maybe that the quality of vision will be like in their 20s. The contrast sensitivity, it's amazing post-cataract, but because it's completely reversible. But glaucoma, if you lose even an iota of your vision, is lost and lost for life. So between the two, I would stress more on glaucoma. So whenever you go for your checks, it's go to good eye hospitals with due respects to optical outlets, but get your eye pressure checked. If at all there's a family history of glaucoma, it's more important that you see to it that your pressures are checked every year. And post 40, I feel once a year get your eye pressures checked.
Right. And I remember you said it comes in silently and it can also hit you or go away silently. So one has to be extra cautious about it. And I think that is where, at least as far as cataract is concerned, health insurance comes into play. Today, health insurance policies not only cover cataract-related surgeries, but you can also get your daycare treatments covered under health insurance. So we would encourage all our friends to consider it seriously to ensure that you are financially protected. Moving on to the topic of diabetes. How much of an impact does diabetes have when it comes to the health of our vision?
Humongous. Diabetes is like a challenge. If uncontrolled, it can cause irreversible blindness. And a diabetic patient has to be extremely careful because there are two organs where the blood vessels, the capillaries play an important role. One is your eye, that is the posterior part of your eye, that is the retina.
Right.
Those capillaries where the blood with a high sugar level is moving around. Your big blood vessels, they're fine, they can sustain that. But those fine capillaries right on your retina, at the back of the eye, and they have been trying to sustain this blood with this high sugar level day in, day out for years. One fine day, they're going to give up.
Yeah.
They're going to burst. You have bleeding in your eye. And they burst, they're gone. And the bleeding is going to cause its ramifications. So, what is the treatment? Prevention. Don't take your sugar levels for granted. It's a very, very, very high price to pay. The consequences, the ramifications should be out in the open. If you're a diabetic, just going to the doctor, getting your eyes checked and coming out with fine, everything is fine, doesn't mean everything is going to be fine forever. Bottom line is your root cause is diabetes, and that has to stay consistently normal for each day of your life.
Right. We are seeing an early onset of vision-related issues amongst children also. So as parents, what should they be careful about? How often should they get a health checkup done for their kids, even if they don't complain?
See, if you follow the right protocols. So American Society of Pediatric Ophthalmology has set it up straight. No symptoms, 3 years to 18 years, once a year eye checkup is mandatory. No symptoms.
Okay.
Now, if your child has been diagnosed with a refractive error, is a myopic, has been wearing glasses, then follow the ophthalmologist advice. And once a year won't be sufficient. You may have to visit maybe every 3 months, every 6 months, if you have a squint, any other error. But no diagnosed anomaly, and still annual checkup from 3 to 18 is mandatory.
So, friends, once in a year, even if there are no symptoms for anybody who's aged between 3 to 18, very important. What is the golden rule to be followed for a lifelong healthy vision?
As far as eyes are concerned, golden rule will be lifestyle changes. There is no escaping the simple basics of life. Good sleep, manage your stress levels well, and healthy lifestyle, nutritional based. Fast food is good, but it's occasional. So going back to the basics is always something that will sustain your good vision for the rest of your life.
So, doctor, you mentioned about annual health checkup for anybody who's over 3 years to 18 years of age. How much of a role do parents play in the deteriorating vision of the child today, in today's day and age?
See, Neeraj, if a parent is complaining that my 5-year-old is a lot on the mobile phone and the parent expects the doctor to reprimand the child. Now, I just had an interesting situation 3 days ago in my clinic where a mother was like, again, same a 5-year. 5-year came in because it was a 5-year-old kid. And she kept asking me, doctor, tell the child not to use the phone, not to use the phone, not to use the phone. Normally, I would say, I would abide by the patient's, But maybe it was end of the day, my tolerance and patience level was also at its lower threshold. I happened to ask the mother, I said, why does a 5-year-old need a mobile phone of his own, and that too a smartphone? What's the need?
Right.
Means, is there nobody at home? No, I'm a homemaker. Like, everybody's at home. What are you talking? We have a huge support system. I said, fair enough. I said, then why does it? Well, he doesn't have the phone. I said, that's great. I said, then whose phone is the child using? She said, my phone. I said, that's good. But I said, then there's a simple thing that you can put a lock. Well, my phone is locked. I said, keep it away. It's kept away. I said, in a nutshell, you are removing your phone, opening the lock, and handing it over to the child so that you get your me time.
Right.
And then when your me time is over, you want to snatch it up from the child. So obviously, you are causing an addiction and you are expecting the doctor to de-addict or the child to de-addict as per your own convenience, which is unacceptable. So parents do play a big role. Like you love your daughter and on the 10th birthday, you go gift an iPhone 16 and you expect the child not to use it.
Yeah.
It's like having the cake and eating it too.
Right.
You can't have it both ways.
Well, and you're right. In today's digital age, while some amount of screen exposure might be unavoidable, but by and large, I think parents should take the onus and ensure that.
Yes. Both aspects should be well balanced. One is, to get you you're making the child easy by giving him the phone and finding my peace, and overpouring of your love and emotions. Both aspects are like double-edged swords.
Right.
They are more harmful than they are helpful.
True, right. And that brings an end to our Vodcast. Thank you so much, Dr. Furniturewala, for patiently answering all our questions, making us better informed. As I say, half knowledge is more dangerous than no
Very
knowledge. And you've enhanced our knowledge. Thank you
Thank
so
you,
much.
Neeraj, for having me.
Thank you very much.
Thank you.
And to a wonderful audience out there, thank you very much for joining us. In case if you have any doubts or queries, please write to us or slide into our DM @HDFC ERGO GI, and we will try our best to answer your queries. Stay informed, stay healthy, stay insured. Thank you.